Well, I want to thank the folks with Pelleve at Elman for inviting me to do this workshop. I've had a Pelleve device. I believe I bought it in 2008, 2009. And it's been a really nice adjunct in my practice, and we're going to share a little bit of our experiences. And I do like this elegance through science because there's science behind the treatments. So what is Pelleve? Basically, it's a fairly painless, it really is a painless treatment that heats deep dermal layers with advanced radiofrequency technology. So this is an RF device, and to make this point. So again, with heating of the tissue, collagen is going to contract and tighten, resulting in a reduction of wrinkles. Elastin is going to be more uniform, and post-treatment, new collagen is going to begin. And you have increased skin quality, firmness, tightness, and wrinkle reduction. This is not surgery, all right? So if for somebody who's expecting tightening equivalent to a facelift, a neck lift, this isn't it. But this is definitely a nice adjunct and a standalone treatment for patients that have some mild to moderate aging of the skin as well. It's nice because you can customize the treatments, so you can individualize a treatment for efficacy. It's comfortable. Patients tell us that it kind of feels like a warm massage, and it's one of the few things I do in the office that doesn't actually hurt. I do a lot of injectables, and I do a lot of resurfacing and peels, and this is something that's a lot more comfortable to have done. The other thing is it's efficacious. We're going to show you some data, including histologic data as well. And it's a cost-effective treatment for both patient and the provider as well. And it's the ideal thing for somebody who's interested in non-invasive, non-surgical skin tightening, improvement in skin laxity and sagging, kind of wanting that overall fresher, rejuvenated look. It says virtually no downtime. There really is no downtime. It's not just virtually. There is no downtime with this. I've had it done between patients as well. So, and people can go right back to normal activity. So this is a lunchtime procedure, using that. We just made this little slide a little earlier this afternoon because when we say it's like cost effective, what's the cost per patient? I'm going to just preempt that question right now. When you have when you buy the hand pieces, there's 3 hand pieces, and it runs $895. Each hand piece has 3 hours of continuous active use. So that doesn't mean it's 3 hours from the time you turn it on and then it just, regardless of whether or not you're making contact with the skin and delivering energy. Now, this is actually when the energy is being delivered. And you can get an average of about full face treatments per handpiece, but really the faster you do it and as you get more comfortable and are doing the treatments, the more efficient it becomes, and it's not unusual to get 5 treatments, but I decided to be a little bit more conservative. There's a gel pad per patient that has to be used, and that's $8. Gel, because there's a specialized gel that you use, and I have used the regular gel, and I thought, well, I'm going to save a little bit of money and use just regular ultrasound gel. It does make a difference. You use the gel that comes with it, and conservatively for a full face, it's about $8. So maybe $91 tops. I want to give you worst case scenario. It's very variable, depends how, but if you're talking, and of course the size of the face would be variation, a small face versus a large face, but as a very conservative estimate, that's what you spend. I live in San Antonio, and treatments are very variable, like what people charge, as in anything, right? Just like if somebody's doing a neuromodulator, let's say Botox brand, some docs charge $20 a unit, some people charge $10 a unit, some people charge $8.99 a unit. So that's the variability. But me living in San Antonio, which is it's not an area of tremendous affluence, if I can put it that way. It's about $700 for a full face. We can do it differently if they package, but you can already see that the return on on your investment is very, very reasonable, especially considering that in my office, my esthetician performs the treatment. And of course, that may vary from state to state, however this is done. But I can delegate this procedure in Texas. And another little hidden pearl here is that it's a nice time for the esthetician or whoever is performing the treatment to bond with the patient, to discuss what other services are offered, gain confidence and trust, and you end up upselling quite a few things in the office or referring for others. So it's not unusual for a patient who has a Pelleve treatment to then come see me for some other type of treatment, maybe neuromodulator, maybe filler, maybe even just an overall skincare regimen as well. This is what the system looks like. And these are the GlideSafe handpieces. And they come in different sizes, 7.5 millimeters, 10 millimeters, 15 millimeters, 20 millimeters. And I think probably the more popular ones, at least in my practice, are the 10 and the 20s. But I think in speaking with the folks at Elman, 10, 15, and 20, roughly in about 1/3 of each is, and their volume of sales are the most popular ones as well. The nice thing, and I kind of want to, I want to make a little extra point about this. With radio frequency, with other devices, if you are still delivering energy and remove the handpiece from the patient, you can cause a spark. This has built-in safety mechanisms, so that way there's no risk of sparking. So it's very versatile. For those of you who do a lot of surgery, you know this is kind of your surgitron. So you've got your surgical, you can use it as an adjunct, not as an adjunct, you can use it for your procedures, for cutting, for cauterizing. I use it in my practice as well when somebody isn't getting a treatment, for treating things like dermatosis papulosa nigra, for treating sebaceous hyperplasia, xanthelasma, telangiectasias. This is beautiful for telangiectasias, especially ones around the nose. Does very well, and you don't have purpura or the crusting for purpura that you can have with lasers. You certainly don't have the same discomfort. So it's very versatile that way. It's portable. I like the portability. I have a satellite office, so if I want to, I can pop this in the car and take it to a satellite office as well. Mechanism of action. So the GlideSafe handpiece is delivering RF energy to the epidermis and deep dermal tissues. There's minor thermal injury on purpose. It's controlled injury, but we're basically tricking the fibroblast into thinking that there's been heat injury. And what does that do? It causes the body to start remodeling, to make new collagen as a response to this perceived injury. Not really an injury, but something that we're controlling and very precisely as well. So again, we get collagen contraction, neocollagenesis, and elastin uniformity. Remember that neocollagenesis, collagen production is about 90 days, and it is important to set expectations for the patient that the full benefit probably won't come for about 90 days, but I promise you they're going to see immediate tightening of the skin as well, perhaps because it's a little bit of edema and the heating, but it's something that a patient comes in, gets it done, and they're happy to go to a dinner party that evening, and there's absolutely no problem with that. So you're going to get increased collagen. There's going to be contraction of the skin surface, nice tightening. And again, the other thing that I think is an important distinction, because I had tried Thermage earlier, and I don't know if any of you all had done it, and this is not to disparage the equipment. I think it's very valuable, and I certainly have very, esteemed and well-respected colleagues and friends who like it. But I personally, I guess when I tried it, it was earlier on, different treatment paradigms, protocols, and I was of that generation that ended up seeing like indentations in the skin, loss of fat, and that's not what we want to produce here. But with this one it doesn't really impact the fat. So the 4 megahertz frequency doesn't impact the fat, so it's safe to do over all areas of the face. And you don't have to stay just on the periphery as well. So that's one of the things that I think is an important distinction. Here's a video. And the way that it's done is you're making small kind of corkscrew circular movements. Notice that they're going, fairly quickly. And I'll make a point about this as well. Like anything else, whenever you get over a bony surface, it can be a little bit more tender. There's a thermometer that comes included. Look, they magically got to 42 degrees. We're trying to get to like 39 to 42 degrees externally, and that'll reflect a higher temperature deeper down where fibroblast activity is. You notice that there's some erythema. The erythema resolves very, very quickly post-treatment. I've had it done. I'm the type of person who gets extremely red with anything, and mine was gone within 5 to 10 minutes as well. So I just thought it was kind of it's nice to see this video. I'm just going to speak, just kind of here from my own personal experience. It took me a little while to get an established treatment protocol. The company's wonderful and works with us. We're trying to get together a manual, and there are treatment paradigms here, protocols for achieving results. But initially, it was, sometimes we did side-to-side passing, et cetera, and I think most of us agree now that doing those small circular movements are the most efficient way and the best way to do it. And I'm not going to dwell on the technique, because we're going to actually do a treatment here. So again, mechanism of action is we want to increase the amount of collagen to give support and thickness to the skin. But remember that elastin gives kind of that snap, that nice resilience. So we want uniformity of elastin fibers as well. Again, we're wounding the skin. There's a little bit of denaturation of the collagen, rearrangement, there's a wound healing response, and remember that you can get improvement up to 6 months, but typically 3 months for patients to really see results as well. This is some histology, because, again, as dermatologists or in anything, having histology to back it up, I think really, brings the point home as well. But you can see in the pre-treatment photo, you've got these small diameter fibers with very distinct borders, but post-treatment, you can see now that there's larger diameter fibers with loss of distinct borders. So there's plumping and thickening going on as well. You can see this as well. Look at the change in the epidermis as well, but you can also see that there's inflammatory infiltrates and area of focal edema as well. But this is what we're showing here. Clinical data. So this is actually a study that's going to be presented, I think, by Dr. Moy tomorrow morning at about 9 a.m. on Pelleve, because there hasn't been as much peer-reviewed literature out. But this study has been completed, and it was 49 men and women ages 30 to 71, looking moderate to severe wrinkles, 4 to 9, on the Fitzpatrick Wrinkle Assessment Scale, so using a validated scale. 2 treatments, 1 month apart, and 3D photographs were done with the Canfield, the Vectra, and at baseline and 120 days after the second treatment. So I don't want to give too many details and steal anybody's thunder, but look at that, an 85% overall patient satisfaction rate with this treatment. And I have to tell you, I may have at least that much, if not more, in my practice. And I do a lot of volume. I do a lot of things like Sculptra, other, as a biostimulator. I do fillers. I have Fraxel CO2, Fraxel Restore. I think this has one of the highest satisfaction rates, and it doesn't cannibalize the other things that I do in the practice either. So again, with this is Pelleve clinical data. This was in getting the device approved, but 93 patients were followed for 6 months after a single treatment. And this was done with blinded assessors, 2 facial plastics and 1 dermatologist. So that's nice. It's kind of like this meeting. And almost 90% retained photographic improvement at 6 months as well. So you can see with this. So indications for use. So it's been used in Europe for wrinkles and rhytids since 2006. And then in May 2009, Elman got FDA clearance for the Pelleve system to be used for non-ablative treatment of mild to moderate facial wrinkles in rhytids for skin phototypes 1 through 4. This has to be sold to a physician, so in your practices, you don't have to worry that just anybody can buy it. But on the same token, depending on your, each regulation state by state, it is something that you can delegate as well. So who's the ideal patient for this? Typically, the ideal patient is going to be around 35 to 60 with moderate skin laxity, but relatively elastic skin. So a little bit of looseness, but still has that ability to snap back. You can have nasolabial folds, periorbital wrinkles, glabellar fold, early brow laxity, some forehead wrinkles on the upper lid as well. Who's not a good patient? Well, not somebody who has a lot of severe photo damage, who's got that crinkly, crepey skin that probably is going to benefit more from a more aggressive procedure, maybe some CO2 resurfacing as well. But we're talking about tightening that envelope. And if there's a complete loss of elasticity and there's not really a way to see that envelope shrinking, that's not the person that you want to do. This is not for somebody with very deep wrinkles. And obviously, like in any other type of cosmetic procedure, it's not for the person with unrealistic expectations either. We added this little slide this morning as well as this afternoon on combination treatments because this question comes up a lot. And of course, as you get comfortable doing the treatments, your imagination will run wild and you'll figure out ways to maximize other treatments as well that you're doing. So for Botox neurotoxin A, we agreed that ideally 2 weeks before the treatment to enhance neocollagenesis. So in order to have better neocollagenesis, because if you have decreased mechanical breakdown of your collagen, you're going to get better results. It's like anything else. We do it just how we do neuromodulators before laser resurfacing or other things. This is something that I think this is a good way to do it. I don't do it on the same day because there's data to show that heating tissue may very well prevent binding of the neurotoxin, and you won't have the same results for that. So don't do it on the same day. Fillers. We prefer to do it on separate days, but if it's on the same day, Pelleve first, and then the filler, as opposed to the filler first. And then the Pelleve, you don't want to heat it, but also the manipulation that's going on of the tissue. But PLLA, I love sculptor aesthetic. I actually like to do these treatments. I like to stagger treatments every 2 weeks. On, let's say, day 1, I might do PLLA. On day 14, come back for Pelleve, and so on and so forth, alternating. And I do think that it gives a really nice synergy between the two treatments. And you're treating on completely different planes as well, so you don't have to worry about that. But the idea is we're turning on collagen production by 2 different mechanisms as well. If somebody's going to, I don't do facelifts or blephs or anything like that, but if somebody's going to have surgery, then why not do the Pelleve beforehand to start tightening that skin, get neocollagenesis going, enhance the results of the surgery. But you can certainly also do it during the actual surgery for making clean incisions and cauterizing as well. And remember that with radiofrequency, you're not dispersing a lot of heat. It's very precise and controlled, and touching back to other uses for your device, such as sebaceous hyperplasia, DPN, those types of things. When you're turning on like if you're using your hyfricator, which is easy, I mean, that's what I did my whole life, you go on there, but you're really creating this like tremendous like explosion of energy around it as well, and the char is actually conducting heat as well. With this, you're keeping the heat localized, so you're minimizing thermal damage and spread to surrounding tissue, so it's a much cleaner result and much faster healing as well. So what to expect pre and post Pelleve? Well, it is that nice deep warming sensation. Patient feedback regarding heat intensity is definitely helpful because you don't want to overheat the tissue, but at the same time you don't want to undertreat or you're not going to get the results that you want. It takes about 45 to 60 minutes to do a full face. It doesn't take, but some people come in and just want periorbital region done. Some people want just a little bit on the jawline, so you're going to have to, tailor that. And as far as erythema and edema, it resolves within 2 to 24 hours. I've never seen anybody that's had more than a few minutes. And believe me, in my office, they call me, 1 hour later if there's anything that they feel is out of the ordinary as well. Set those expectations. It's going to be multiple treatments. I know that I presented data that said patient satisfaction and photographic improvement after a single treatment, but I think that, and the consensus is not just me, I'm just delivering the message here, but I think 3 or more treatments spaced a month apart is the way to go. I'll do them as close together as every 3 weeks as well. Might be some immediate changes that are noticeable, but probably due to a little bit of the mild edema and a little erythema there. But again, neocollagenesis occurs over time and continues for up to 6 months as well. Here's some examples, full face photos, and you can see just a single Pelleve treatment after 180 days, and this is very impressive. If you ask, and you can see certainly the improvement in lines as well, and you can see this also, some retraction improvement there. Full face treatment, I think this is nice. It's also nice, fairly consistent photography as well. This is from a very dear friend of mine and colleague, Dr. Flor Mayoral, and she's the one that got me turned on to this machine. She's kindly indicated for you where the improvement is under the eyes. And this was one eye treatment only and one treatment for the full faces. I'm sorry, these were 2 treatments. One was only for the eyes and the other was for the full face as well. This is nice because, again, there are markings on here so you can actually see the distance from brow to the lashes, how that increases. And we took the liberty of adding arrows to these photos as well today so you could see, but look, it's pretty impressive, the changes here in this area. And the way when we treat eyelids, and I know this is going to be brought up, but you pull back on the skin, and as long as you're treating over bone, you don't have to use eye shields or anything like that. You don't want to just treat the soft tissue because you don't want to heat the eye, the globe itself, but you can really pull tightly on the skin, and that way you can get fairly close to lashes on the upper or lower as well. And this is where I have a limitation with other devices such as the high-intensity focused ultrasound or the L-therapy that I also have in the office. I can't get as close in those regions as well. Again, this is 4 Pelleve treatments spread out over 90 days. You can see that for crow's feet. You can see on this one as well. And these pictures are from Steve Diane, who's I know been all over the place, and in fact I've got to go speak on a panel of his right after this session. And you can see nice improvement under the eyes as well, and also improvement in the lid creases. This is another nice photo, and the arrows show you, but just in case, I can guide your attention to this. Look how the hooding here has improved as well. There's been no neurotoxin treatment. You've got same position of your frown lines. And these are things that we actually see in the practice. Improvement in the nasolabial fold. Here are these, or more etched in lines as well. And if you have any questions, we'll be happy to answer them. I think in the interest of time, it's best that we start treating our patient.
Vivian, just a couple of points. Very nice presentation. There's a few things I just wanted to mention, adding on to what she was saying is, the boom in cosmetic surgery is apparent. Everybody knows about that. You know the numbers. Last year, over $10 billion were spent on this. It's getting to the point now where patients are demanding these kinds of procedures where they want minimal downtime. They don't want to laser. They don't want to burn. They don't want to peel. And they want to be able to go to dinner. They want to be able to go to their friends that night or that day. There's few modalities out there that offer that. You have to figure out in your practice which modality is going to fit based on what kind of practice you have. I know in my practice, for what I do, this is perfect. And you have to make that decision. But make a decision, and my suggestion to you is move forward with this, because if you don't, in your town, they're going to go to somebody who does offer it, because the numbers have already shown that. So it's not a matter of should I don't think this is going to work, or people want bigger bang for the buck. The reality is that's what they want. And so you have to pick the modality. And this technology, for me, works very well. For her, works very well. And I think you should at least look at this, because the versatility is pretty remarkable. And the other thing that's very important for me, what I found with my patients is this is an industry of hospitality. I teach my residents and fellows, you're in the hospitality business first, you're a physician second. And if you reverse that role, the person across the street who rolls out the red carpet to them and gives them grapes and fans them is going to win that patient over. If they have pain, in my practice, any pain, it's not worth it. They're going to feel it, they're going to remember it, they're going to walk out the door. And then you come to somebody who doesn't give them pain, they're going to feel very comfortable there. If you can get a modality like that, in my opinion, it's a home run. So I've tried a couple of them. For me, this works very, very well because of that reason. We have a volunteer, Sabrina, is here. She is perfect because she's never had this done, and she's very queasy and she's afraid of pain. So if we can convince her, we'll be in good shape. She has this antenna that's between her shoulder blade. The closer you are to where you're going to treat, for the face area, the shoulder blade is perfect, right between it, close to the neck. That's where the best conduction is going to happen. What we're going to do on Sabrina is we're going to work on the forehead a little bit, come around into a crow's area and down into the lower lid cheek area. Probably the most common area that patients come in asking for is the forehead, to give a little brow lift, get rid of the crow's feet, and the cheek and the lower lid junction. We can come down to the jowl area, or this is really where you're going to get the biggest bang for the buck of the patients, because the response is pretty remarkable. You want to explain to the patients, as with anything, the expectations. This is not a facelift. This is not a surgical procedure. This is a non-surgical modality that will the fine lines will go away, the texture of the skin will change over time. And you need to tell them that the results will be immediate. They'll go home and they'll look in the mirror in 2 weeks and they'll say, what happened? But they need to know that over time, the collagen takes a while to start getting collagen thickness and neocollagenesis. And that mechanism of neocollagenesis, as Vivian said, takes about 90 days. So in 3 months, she's going to start seeing some changes in her skin. So everybody's different. You have to determine in your practice, by looking at the patient, how many treatments they're going to take. Anywhere from 1 to 2 treatments on a 25-year-old, let's say, and as they get older, the collagen is lost, they're going to need about 3 to 5 treatments. The study showed about 3, so when we talk to patients, we're telling them 3 treatments probably minimum for you, and then from there, it depends on the patient. This is the gel. This is the Pelleve gel, treatment gel. As Vivian mentioned about ultrasonic gels, and I can tell you, I did use some of that, and it didn't work. And it doesn't work because of the consistency and the way they made this gel. The way they made it is the conduction is much better through this gel system. And the other sorts of gel that we've used actually used to clog up the handpiece, and it wasn't as consistent. So this is probably the best thing for you to get, and it pays itself because you incorporate it into the price. We're going to measure her temperature, and as you know, the temperature right now is about 32 on her. Okay, So we're going to do, you ready? So it's a circular movement. Do two set of movements. I go up in that fashion. I'm also putting the forehead on stretch. And I think if you pull the skin where you're treating, it actually allows this radial wave to get into each wrinkle, so the dermal-subdermal junction, which allows it to fill in better than if you don't stretch, in my opinion.
What size handpiece are you using?
This is now set at 32. How's it feeling on a scale of 1 to 10? 1 nothing, 10 fire.
15
2.
millimeter.
And you're very queasy, aren't you?
Yes.
Okay. So she likes it.
And he's using the 15 millimeter
This
handpiece.
is the 15 millimeter handpiece. It's already starting to get, I don't know if you can see that, it's getting red.
A little
Can you-
pink.
I don't know if you can tell up there. But as we do this, I'll do about 2 or 3 passes to get it. Now she's at 40. Can you see this? At 41? I don't know if you can catch it on there. Now, I did about 3 passes going up. I'm going to do probably about 2 passes going this way, okay, from medial out. And this will actually elevate the brow as well. How's it feeling, okay? Good, pain-free, she says. And this is the beautiful thing about this, is that they really don't feel pain. It's like a warm massage, and she's getting red right now, so I know that I'm getting very close to her end point.
And I love this because when I first got the
45.
device, I was told to treat for X amount of minutes and leave it on and continue heating. And yes, the more you heat,
Okay.
the better results you're going to get. But I think by changing the passes, and it's kind of like for those of you who do fractional resurfacing, like the Restore, you go in one direction, then you change the other direction, and then you change directions again. And that way you get nice overlap and you're not leaving any areas untreated.
That's a good point. Now I don't know if you can tell, but she's already getting some pulling of her brow laterally. So I'm doing I would do about 5 passes on her in the forehead area. And that's red, so that's the forehead. Now I'm going to come around to the crow's area. I'm still using the same handpiece, and we're going to come down in this area and pull the crow's feet up. So I'm putting tension, I'm pushing up on her skin in this fashion, and we're going to now go up in this direction and in this direction. And by doing this corkscrew in 2 different directions, you're actually dissipating that radial wave more confluently. You're actually getting it much deeper into each wrinkle, and therefore you're getting the wrinkles filled in and getting more denaturization of that collagen and neogenesis as well. You doing okay?
Yes.
We encourage everybody to take photographs before photographs.
that
You
one,
can
right?
take them at each
Okay.
time point as well. You know, try to keep photography as standardized as you possibly can. Pull the patient's hair back, remove jewelry, and that way you can create your own before and afters in your practice. You know, first you'll have to rely on somebody else's, but then you create your own little patient portfolio of befores and afters, and that in and of itself will also increase the number of treatments that you're offering. The more treatments you do, I mean, I can already tell you that in our practice, the amount of treatments we do also correlates with how much skincare we move in our practice as well. So
Okay.
not just in other procedures, but even other things that don't rely on your hands doing the treatment.
So I got her up to 42 degrees around the crow's area with the 3 passes that I did. It's much thinner skin in there. The thickness of the dermis in the eyelid is about 0.3 millimeter thickness, so you don't have to do too much.
Can I interrupt for
Yeah.
2 seconds? We're trying to get the pinkness to project, and that we were just encouraged to put you a little more
You want to go more vertical?
Yeah, so let's try to do the chair a little bit more. Are we going to go? Oh, that's going this way. Backrest. It's magical.
There you go. You can see
All right.
you can see it's a little red, slightly dematous. She's at 42 here, about 42 here, and then we can do the cheek lid junction with the same thing. Can we actually change this? I'm going to change this to. Yeah, let's do the 10 here. So I'm switching to a 10 millimeter for her lower. So she's about 26. You doing all right?
To do with this thing.
And look up for me. Good.
Just gonna see.
So again, it's corkscrew, and I'm going out laterally.
And you're pulling on the skin, right?
I'm pulling up like this, just to get into each one of those wrinkles.
And of course, if you put tension on the skin, you're going to create a more even plane and a more uniform delivery of the energy as well, better results. But in the eye area as well, if you don't want to treat inside the orbital rim,
That's correct.
so pulling down the skin allows you to treat more skin and use the bone as its own natural shield.
And here I am going up against, so she's now about 37. So I get this also up to about 41, 42. And the full face will take me about 45 minutes sometimes, anywhere from 30 to 45 minutes, depends on how much they need and how fast I can go.
Do you do the treatment yourself, or does someone in your office
No,
do
I have
it?
somebody in the office that does it. Unless there's a person that wants me to do it, I'll do it, but most of the time I have an esthetician that does it. How you feeling?
Great.
Doing okay? I don't know if you can see slightly. There's improvement of the lines between the right side and the left side because of the
Can you turn a little bit toward
contraction.
me? Let's see if we can show the. Oh, we got the goo on there, but
Yeah.
yeah, you can definitely see the difference.
I mean, let me just do
in-
this. I'm
in
going to
the
wipe a little bit of this off so you can.
The crow's foot area, as well.
Yeah, you can tell the. How you doing? All right. Okay. So I would do probably, and the brow also, yeah, I'd probably do about 4 or 5 passes here, about 4 or 5 passes here. And on her, you can get underneath the lids by having her look up, pull the lid down, and stay on the orbital rim, as Vivian was saying. And that'll actually take care of some of the fine red is under the eyelid, which is actually very, very nice with this technology. How you feeling?
Great.
I think one of the things that I absolutely love about this treatment, I'm trying not to stick my finger in your face,
Wasn't
I'll
too
use
bad.
this.
No.
But these types of lines that go more onto the cheek region that aren't really amenable to treatment with neuromodulators, that sometimes just require more of a filler, this is a great, I find Pelleve to be especially useful for these lines over here that don't improve easily with neuromodulators, or especially in patients who don't want to have a filler as well. So I like it for that. And then with time, as you'll check your patients, when they smile, you'll actually make less of those lines as well.
So she'll come back, we'll do another treatment 4 weeks. We'll probably have 3 treatments minimum over a 3-month period. And then she'll notice something when she goes home, and then she comes back in 4 weeks, we'll hit her again. And that's the whole process of how this works, and patients start noticing it in about 90 days. Some actually sooner than that. And then they'll come back once she's done with that treatment. They do it once a year. I have them come back once or twice a year for a treatment, and it keeps the maintenance program going on them. Yeah? You okay?
Great.
All right. How are we doing on time?
We're about to have to be wrapping it up pretty soon.
Wrapping
We
up,
started
okay.
a little bit late because of the last session. For people that are coming in for the next one, we got a little bit of a late start.
Are there any questions? Yes.
Thomas Tork from Germany. I work with the device since '96, actually with radio frequency, and since 2007 with the Pelleve, or Radiage as it was called by then. And I want to make a suggestion which makes patient management a lot easier in my eyes, I think. I do one side of the face, I do one side consequently, then I take the gel off, give the patient a mirror, and they see the difference right away. And this is just part of what we can see in 6 months, but it shows. And when you talk to them the next time and they came home and they met their friend at the bus station or wherever, they say, "Wow, you look, what has happened?" Or on the very skinny ones, you have these athletes who are like in their mid-30s or early 40s, and who are like very, very defined, and they would look if they actually would gain weight, but they don't obviously want to gain weight. The typical comment is, "Hey, did you I see you didn't, but it looks like you gained weight." And that's what the patient absolutely like. And like with the one-side treatment, I find it very helpful for the convincing process to show it to the patient.
Thank you so much. That's an excellent point that we had not made yet. Typically, you can pick the higher side of the face because it's going to be even more dramatic, and you start with that one and then show the patient the mirror and look at the halfway point. But it is it's very helpful for them to see, and thank you so much for bringing that to our attention.
Yeah, that's a very good point. That's how you get them excited about this, because they do see a difference when you do one side. Yes.
I'm sorry, how do we charge?
You know, listen, it varies in your practice. I can tell you that it ranges. In our practice, it ranges anywhere from $200-300 to $1,000 or $800-900. Depends on the area, depends on the age, depends on how many treatments I'm going to have to do. You have to find out in your market what the market bears. But the range varies between those numbers, and Vivian showed you for one full face treatment what the average cost is. But we had to do that. We had to do a analysis in the market and see what the market bears, and we had to price it accordingly. But that's something that's not difficult to do, and I think you can figure that out and then price that, or with the neighboring areas. No, you can. That's the beautiful thing about this. I can be doing surgery, and my esthetician in the office is doing this while I'm there. So you don't have. You can, but you can have somebody else do it, which makes this more advantageous.
And I think the point we made is it depends on each individual, you know, regulations in each state. So in Texas, I can delegate it to my esthetician. I don't want to speak for all 50 states, being that this is a device that can only be bought by physicians. But typically, it is delegated to somebody else in the practice.
You have to look at the economics, look at your practice and what makes sense for you in your practice. And as Vivian said, if somebody wants a big bang for the buck next week, you need to do surgery. You need to figure out exactly what they're looking for. This is perfect for the people that don't want anybody to know what they had done. They want to be able to go swimming, go out, go in the sun, and not have to worry about it. In today's economy and the workforce, I have so many patients that are applying for jobs. They want to be competitive with people that are 10, 15 years younger than them. It's a great modality to give them. So when they go to the interviews, they don't feel that they had something done or nobody can see that.